Now, my argument against the voice and the whole voice treaty, truth, 28 pages of the Uluru Statement agenda was that it would create two classes of Australian citizen. Ordinary Australians on the one hand and so-called special Australians on the other. Those whose ancestry predated 1788 and who'd get special treatment as a result and a special stay. And in every state, by a majority of Australian voters, we rejected race-based division. But that hasn't stopped Green left governments and ideologically captured institutions from pushing on anyway with an Indigenous separatist agenda. Today we learned that this even extends to giving Indigenous people a special fast track at a hospital emergency department. St Vincent's Hospital in Melbourne is part of the wider St Vincent's Health Australia network of hospitals, originally run by the Catholic Sisters of Charity. Last year, the hospital introduced a policy that Indigenous patients presenting to the emergency ward would automatically be assigned to triage category 3. That means they're supposed to be seen as urgent within 30 minutes. Now, they are assigned as urgent, whether they need to or not in medical terms, because they're Indigenous. Now, this was done, the hospital claims, because, quote, research showed First Nations patients were waiting on average longer and were more likely to remain engaged with care if seen within the first hour of ED presentation. But if Indigenous patients really were waiting longer, well, surely they would have been waiting longer because their cases were less urgent. And if that's right and their cases were less urgent, then why should they jump the queue based on their race? Other hospitals in the St Vincent's network reportedly emphasise what they call culturally safe care or pathway support, but seemingly do not automatically classify Indigenous patients as urgent. But rather than being called out for dividing patients based on the colour of their skin rather than medical need, St Vincent's in Melbourne's now been nominated for an award for its race-based discrimination. And the citation for this Victorian Public Healthcare Award reportedly reads that St Vincent's First Nations patients are now seen more promptly than non-Indigenous patients. This is simply wrong. This is medical apartheid. I can't describe it as anything else. But when asked about ranking patients based on race rather than medical need, she didn't reject it. In fact, Victorian Premier Jacinta Allen, she backed it in.
I think this is a good example of hospital leadership looking at their data and improving their processes and systems to get better health outcomes for particularly vulnerable groups in our community. First Peoples have poorer outcomes. First People have been waiting, and St Vincent's have done some work, have been waiting longer to be treated and are putting in place an initiative that supports that principle of treating everyone who comes through the ED in that triaged way of treating the sickest patients quickest.
Well, no, this isn't about treating the sickest patients quickest. That's the whole problem. What you're supporting is a health system based not on what you need, not on how sick you are, but on the colour of your skin. And if you think this is shocking, just wait. There'll be more of this race-based privilege if Labor's new Indigenous Treaty Bill passes the Victorian Parliament. Now, can you imagine the outcry if this edict was reversed, if Aboriginal Victorians went to the back of the queue rather than being moved up because of their race? Or if we made Arab Australians wait longer than Greek ones? Or if we told Chinese Australians that Anglo-Saxons would see a doctor faster than them? I mean, at every level, this is wrong. Honestly, what is happening to the colourblind Australia we thought we lived in?